I'm Dr. Shireen Balsan. When I first started as a family physician 10 years ago, Lebanon's healthcare system was considered one of the best in the region. But over the years, chronic political mismanagement plus corruption set in. Then, the 2019 financial crisis struck, and the result has been a near complete collapse. Today, hospitals and clinics are overwhelmed. Medicines are unavailable or unaffordable. Hundreds of doctors, specialists, and nurses have left the country, and hyperinflation has left 70% of the country living below the poverty line, unable to afford care.
خوفيني هلا تتجي الكهرباء انت تاخرت على حالك اجمع مي ما بقى فينا نسحبه طلعوا لورا من اجريك صار يطلع توصل لهون.
Dr. Mawad's Family Medical Center opened in 2012.
Many times they are too late to have their treatment because they cannot afford directly to pay their bills.
Almost all of Lebanon's hospitals are private. To manage, they made drastic cuts, including closing entire wards.
More than 1 year, about 50% of our hospital is closed. We cannot afford to open all the departments. It's not only a health problem, it's a political problem.
Faced with unaffordable costs, the sick come to the free clinics like this one, run by the Order of Malta. Dr. Grace Abirizq helped set up more than 20 primary care centers for the poor. She is the medical director for the order.
Before 2020 crisis, they will provide the primary health care for 26% of the population, but now it's easily for maybe 85% of the population because the situation is catastrophic and we are getting poor more and more day by day.
Marcel is diabetic.
هلا أنا إلي جمعتين مش أخذ الأنسولين كتير غالي يعني مدخولي أقل يمكن من حق الدواء صار يعني لو توفر ما فيني أشتري. James Watt is a former UK ambassador to Lebanon.
There are technocratic solutions to all of this, but it is blocked at a very high level by political fighting and political ideological position taking, which has ruined the country and continues to ruin the country. People are definitely dying.
Lebanon's healthcare historically has been public and private. Before the financial crisis, 51% of the people had public or compulsory insurance. 49% paid for private insurance or had no formal coverage. The Ministry of Public Health covered and still does hospital stays for the uninsured. All patients pay over 10% or more of the costs, money they don't have. Since 2019, the lira has lost 80% of its value, raising healthcare costs by 444%.
يعني أنا بقبض مليون ليرة وإيش بكفي بهالوقت إذا ما بتقبضي 10 ملايين ما بتوفي معي يعني إذا بدك دواء بدك تروحي تشحدي شحيتها.
NGOs like Caritas visit dozens of villages and towns, offering people medical support and medicines. Zaina, a nurse, says desperation is everywhere.
يعني مش بس فرد فئة يلي هن الفقراء أثرت عليهم، أثرت كمان على الطبقة الوسطى على الكل، يعني الكل بتحس كلهم بحاجة، كل العالم اللي بيجوا من جميع الطبقات وكلهم بحاجة للأدوية اللي نحن عم نأمن لهم إياها. الأدوية مش موجودة، بس عندك بس هيدي الموجودة ستريت فود.
Caritas also supports refugees. Since 2015, over 1 million have fled to Lebanon. Amal is 17. Her newborn son is ill.
إنه هني أنا بدل ما بدفع 50-60 ألف في الصيدلية أنا هون عم بدفع 3000 يعني 50-60 ألف أنا عم خليهم حق خبز للشهر كامل.
First thing every morning, Dr. Mawa checks his hospital fuel app. To guarantee electricity, he needs $1,500 a day.
We have only on centimeters. That means we have only 500 liters. If 2-3 hours I am late, no electricity in the hospital.
Before the 2019 financial collapse, the government owed private hospitals $1.3 billion, money that will probably never be reimbursed. That includes Dr. Marwad's hospital.
If the hospitals are not paid, we cannot continue. If the doctors are not paid, they will not continue. I say this is a mafia governing this country, and they cannot give us the chance to modify this. Just think, how do you think a government, Ministry of Public Health, saying to hospitals, do your work and they don't pay us?
The crisis also affects public facilities like Beirut's Rafik Hariri University Hospital. The hospital has closed 200 of its 400 beds. The director says no one is turned away, but the situation is dire.
We need more supplies, we need more medication, we need fuels, because we don't have electricity. We are in severe need in nurses and doctors who left Lebanon. Because the population, they need someone to take care of them.
According to the WHO, since 2019, almost 40% of doctors and 30% of nurses have left their jobs, many for other countries. Dr. Rami Al-Kallab oversees the FMC dialysis unit that treats 60 patients.
The meeting this week in the Society of Nephrology, 40% of nephrologists who answered that or they had left or they are planning to leave within 1 year.
In this severe crisis, the government has been ineffective. It can't find funding and it can't build a political consensus. And so healthcare continues to be fragmented and weak.
International communities, they are looking what's going on here, what's happening here, and they keep watching, okay? They are clear that they won't help our government, but maybe NGOs. But it's not enough. NGOs cannot replace a government.
Yet without donations from the NGO Karma, Karim, a young Syrian refugee with leukemia, would go untreated.
Every cent makes a difference.
If Karma wasn't here, what would have happened to these people?
Either go back to your country or just die. Just die.
2 days ago, we received this suitcase from DC, from the founder, with the money she collected from the donors. It's full of vitamins. This is vitamin D for the bones. We have a different kind of vitamin D depending on the dosage.
2 years ago, two Lebanese friends, one in Washington, the other in Lebanon, started Lebanon DC Lifeline to help those in need.
People are suffering and they are dying because they don't have any medication and any medical help.
These efforts are a lifeline, but not a long-term solution.
Some states, some international community, they have to help us to surpass what we are living now, to build plans for the futures, to help people in need.
The Ministry of Public Health has recently recommended standardizing procedures, unifying overall fundings, and ultimately offering universal health coverage. But decades of deep political divisions, corruption, and mismanagement must be overcome.
Including with a report that's been produced on the Lebanese health system. We're all doing our bit to try and provide the knowledge and the path forward. There's perfectly sensible technical solutions that can be done if there was political goodwill, but that seems to be totally lacking at the very highest levels of the political structures in Lebanon.
The need for change is clear. Without it, The sick will continue to scramble and beg, while carers watch their patients fall victim to treatable conditions.
I have in the elderly house near us, 2 people died because their parents cannot afford to pay them this sum. They stayed 1 month with their fracture, they made complications, and they are dead now.
Lebanon's healthcare system can only survive and rebuild if the state commits to ensuring the well-being of the Lebanese and refugees. Years of political obstruction and fragmentation have left healthcare undermined. What is needed now is deep and dramatic change.
شاغل بالي